The South African Medical Association has welcomed the availability of booster shots and is encouraging all those eligible to get them as soon as possible. About 50% of healthcare workers who received a primary Johnson & Johnson vaccination during phase 1 of the Sisonke program have received a booster dose. For more on this, I'm joined by the chairperson of SAMA, Dr. Angelique Coetzee. Dr. Coetzee, very good morning to you. Thank you for your time. What does this availability of booster shots now mean in the fight against COVID-19?
Good morning, and a good morning to all your viewers out there. Now, it's a very important question. I think it's important to understand that Johnson & Johnson's efficacy were waning between 6 to 9 months. We saw it during the third wave of Delta towards the end, that some of our healthcare workers started to get reinfected again, or breakthrough infections in this case as well. So we then already start to ask the Advisory Committee on Vaccines and SAPRA to start looking at whether it would be possible to get booster dosage for these healthcare workers. The problem with healthcare workers is they are your first point of contact with health when you are sick. So if you have healthcare workers that's not been vaccinated, unfortunately, a third seems at this stage not being vaccinated. It means that when they get sick, the workforce are in trouble, and we cannot allow that. We anticipated the wave. We actually anticipated the wave more towards the end, middle of December, beginning of January, and Omicron just came earlier than what we thought would happen. And 2 weeks before this started, under the Sisonke trial, we managed then to get Sisonke 2 as to help starting vaccinating these healthcare workers. Remember, SAPRA only recently approved the Johnson & Johnson vaccines as a booster for the rest of the public, and we couldn't wait until now. I think this is from this week that they are eligible of getting their shots. If I'm under correction here. Mm-hmm. So we started with the healthcare workers before, and trying to help and assist as much as we can before Omicron or the fourth wave were upon us. But as I said, we were a bit late.
Yeah, and the Pfizer booster shots are also available from today. I mean, that also speaks to an accelerated, pace and fight against the COVID-19.
Yeah. Look, we have enough vaccines in the country. We've got enough Pfizer. We've got enough Johnson & Johnson. And I know that, hopefully in the new year, hopefully in January, that Pfizer, that Johnson & Johnson would be one of the vaccines that we can mix and match, meaning that if you had a Pfizer going forward and if something happened, let's say you had an adverse reaction, you can't get a Pfizer again as a booster or as a second dose, that you can then get Johnson & Johnson. I think it's already approved by SAPRA, and it still needs to go through the Minister of Health. And as I said, that process will hopefully be finalized in January, before the end of January. We are also, SAMA did ask before regarding Pfizer to say, please, can Pfizer come to the table as well so that their vaccine can be used as a mix and match, and hopefully they are now in the process with that as well.
As we take stock of the latest COVID-19 numbers, we know that there were 150 new hospital admissions in the 24-hour cycle, and as of Monday, 8,990 people in private and public hospitals for COVID-19. What does this now indicate when it comes to the strides and the efforts in the fight against COVID-19?
So, again, if we look at only in terms of vaccines, we know that the vaccines are protecting you against severe disease and death, as well as hospitalization. We know that Johnson & Johnson's second dosage, 2 months after the standard one, has got a 75% efficacy against moderate to severe. However, that second dosage, around about your antibodies increased about 5-fold to the pre-boost levels, while at 6 months it increases to 12-fold. So we know Pfizer as well has got a good effect on the antibodies. Therefore, people at this stage hope that they are admitted in hospital, in ICU, are not so much our vaccinated people. It's our unvaccinated people. That there's a huge problem with the unvaccinated people in ICU currently. We have seen that some of these people who have been vaccinated do get severe disease, but again, it's more a pneumonia type of picture that they have. We're not saying that you will never die if you had your vaccines, but your vaccines are really, really going to come to the party when we look at these stats regarding vaccinated versus unvaccinated people. Our hospital admissions, if you look at, over a period of time, it's much more or less stable. Our death rate's more or less stable. It's not that I think there was one day that we had 130 deaths, but most of the time it's under 100. We know that all these hospital admissions is across 666 facilities. And again, some of the people in the hospital, also remember, are not there predominantly for COVID, but for any other disease, or maybe in a motor vehicle accident or trauma, and then test positive, and they would then be seen as a positive COVID case. They will be recorded as a positive COVID case. So the important thing is to ask how many people in ICU do have COVID, and how many are ventilated, and how good are the discharge rate, especially for those who's been vaccinated.